If you are turning 65 and you want to know which choice is best for you, meaning, do I stay on original Medicare or do I go on a Medicare Advantage plan? Then you will want to watch this entire video to the very end because I'm going to give you 7 key differences between both choices. What's up, friends? Rob here with Agape Insurance, and let's dive right in. So key difference number 1 is if you stay on original Medicare, your red, white, and blue is going to pay 80% of your medical bills, and your supplement, Plan G is the most popular one, is going to pay the remaining 20% minus the Part B deductible, which in 2024 is $240. On a Medicare Advantage plan, you are going to have to worry about copays, co-insurance, and your annual max out of pocket. Key difference number 2 is most Medicare Advantage plans are going to be low to zero premium, and that's really going to depend on what area you live in here in the United States. On the original Medicare side, you are going to have a premium associated with whatever Medicare supplement plan you decide to get to shield you against that 20% that's left over for Medicare. So that premium is going to largely depend on whether you get a Medicare supplement plan F, plan G, or plan N. Key difference number 3 is on original Medicare, I can go to any doctor or any provider or any hospital that takes Medicare, which is really pretty much anywhere, where on a Medicare Advantage plan, they are network-based plans. And depending on if I get on an HMO, which is very restrictive, or a PPO, is going to ultimately depend where I can go for my hospital visits or for my doctor visits or any provider visits. So it's one key thing that you want to make a note of here is you always want to check all of your doctors and providers before you enroll in a Medicare Advantage plan. Key difference number 4 is if I stay on original Medicare, not only do I have to get a supplement plan, but I will also need to get a Medicare Part D prescription plan to help me with my prescription cost. On a Medicare Advantage plan, most of them are going to have a prescription drug plan included with the plan. However, whatever choice you decide to go with, you always want to make sure that all of your medicines are covered in the formulary. By the way, help us help more Medicare beneficiaries like yourself by clicking on the like button, the subscribe button, and give us some feedback below and let us know if there's some additional questions that you may have. All right, let's get back to key difference number 5. Key difference number 5 is I must enroll, if I'm on original Medicare, if that's the choice that I make, I must enroll in additional ancillary plans to cover any additional needs that I may have that is not covered by Medicare. Specifically, I'm talking about routine dental, vision, and hearing. Your Medicare is not going to cover that, where if you go with a Medicare Advantage plan, most of those plans are going to have additional dental, vision, and hearing and other benefits as well included with the plan. Key difference number 6 is if you stay on original Medicare, you can see specialists without referrals. If you go on a Medicare Advantage plan, you may need a referral to see a specialist, and they may be required to be in the plan's network. Once again, this is why it's very crucial that you work with a seasoned Medicare advisor like us here at Agape so we can help you get this right the first time. And then the final key difference, number 7, is, and I see this a lot, is nursing homes. If I'm on a Medicare Advantage plan, if that's the route that I choose, then I need to go ahead and understand, or be aware of this, I should say, that nursing homes sometimes don't play nice with Medicare Advantage plans because they're not in the network. And then specifically, I want to talk about skilled nursing care, that you're going to get up to 20 days in a skilled nursing facility or rehab. And then after that 20 days, it's $204 per day afterwards. That's the rate for 2024, where if I choose original Medicare with a supplement, then I could qualify for up to 100 days of rehab and therapy. And I don't have to worry about if that nursing home takes Medicare in most cases. So in other words, I have more flexibility to if this situation does arise. One important thing that I need to make you aware of is, regardless if I choose original Medicare or a Medicare Advantage plan, you still have to pay your Medicare Part B premium, which for 2024 is $174.70. And the only way that you can get that back is if your particular Medicare Advantage plan has a Part B give back option, or if you qualify for Medicaid. Reach out to us today and let one of our seasoned Medicare advisors here at Agape help you navigate all the nuances of Medicare and help you get this choice right the first time. Bottom line is, it does not cost you anything more to use a Medicare advisor to help you make this choice. And you can reach out to us simply by either calling us, you see the number here on the screen, by texting us, by going to our website, or filling out the contact form below. And one of our Medicare advisors would be more than happy to get back with you, once again, at no cost or no obligation to you. Thank you for watching, and go check out my 3-part Medicare 101 series here.